is 360. It's again, welcome. And I am here with Dr. Lubin.
Hello, everybody.
Work with Dr. Lubin over at the hospital. So for those of you who don't know, again, My Wellness Solutions, we focus on detox and cleansing. Definitely a whole other workshop that we can do in terms of nutrition and proper nutrition as we go into menopause, right, Dr. Lubin? I know we've been talking a lot about
Absolutely.
that. There is a lot to talk about, and really your body is not optimized if you are not eating right and giving it the nutrients that it needs. Detoxing is always a good way to kind of like hit the reset button. We focus on contouring and weight loss and all sorts of skincare. Um, and then some of our favorite topics is going to be fertility, and most exciting is hormones. Hormones. Why? Because they really do make the world go round. That is one. But I will ask you all, let's reflect. When was the last time that you truly felt in harmony with your body? I'm so curious to hear some of the answers that you guys have, because I can tell you that there are so many of our clients that don't remember the last time they felt in harmony. They don't remember the last time they really felt like themselves. And really, hormones, you'll learn today, is many times the answer. So, how do you all feel? Do you feel alive? I always like to ask clients when I'm doing my hormones consultations, Dr. Rubin, because this is how I always gauge. Like, when you wake up in the morning, do you feel like a ray of sunshine? Like, do you wake up all rested, or do you wake up like you're really trying to just go back to sleep? You hit the snooze button 1,000 times. How do you really feel? And as we continue to go through this presentation today, really continue to ask yourself, are you like living? Are you thriving? Are you just living? Or are you just getting by? So are you like this? And think about which one of these versions of yourself do you really want to be? Because I really know that so many of our clients, they're extremely fatigued or tired at 2 p.m., anxious, irritable, the night sweats, the hot flashes. We'll talk about sex drive 1,000 times, vaginal dryness. Um, we have an answer before before I became perimenopausal, and perimenopause. That's another one that it can be its own presentation, Dr. Lubin. They're
It's
not
its
talking
own,
about
it's its own subject all by
They are
itself,
not
all the
talking
way.
to us of how
Yeah, it's
crazy
not
it
just
is.
menopause, it's the perimenopause, because perimenopause is going to be there up to 10, even 15 years before you actually go through menopause. You're already starting to feel all these symptoms, these feelings, these emotions, mood changes, and things are
Basically,
happening in your body before you even get to menopause. And so that's really the bigger part of the conversation, because that's affecting so many people, and they're young, so they don't know what's going on. And oftentimes, young women end up going to like 5 different doctors before we figure out that, it's your hormones. So, they've seen a rheumatologist, an orthopedist, a psychiatrist, a neurologist, a physiatrist. They've seen all these other people before they ever get to the point that maybe your hormones are actually where the problem is.
oh, so many,
So
so many,
let's
so many
talk
of us.
actually about what hormones are. So hormones, I mean, you'll hear good and the bad, right? Especially in recent years, I feel like hormone sometimes gets a bad rap, especially after something called the WHI study, or the Women's Health Initiative. But moreover, I understand and I get it, especially when we're talking about things like fertility, and birth control, etc. But the real reality is that your hormones are working in your body as a messenger. That is what is signaling your body to do all of the important things that it needs to do in order to really thrive, in order for your cells and your tissues and your organs to work optimally and maximally, in order for your body to always feel revived, energetic, for you to have equal thoughts, and always feel in focus, and just the best version of yourself. And really, it's your hormones that's doing that for you. And the way that they work in the body, again, is that it's a messenger, it's a lock and key, exactly as we see here, and the most important thing to understand about our hormones is that, yes, we have these fluctuations that start at puberty, but the imbalances can be at any time, and they especially start around the age of 30. So
30, 30.
yeah. As young as 30, women can start to experience hormone imbalances, that are leading, or what we call perimenopausal hormonal changes, that can lead you to actual menopause. So what is menopause? Menopause is when you've gone a full 12 months without a period. And that means that your period has completely stopped, never to come back again. I'm not talking about because you were pregnant. I'm not talking about after a baby. I'm not talking about because you're breastfeeding. I'm talking about your period stops. And for most women, the average age in America is about 51. But you can go into menopause as early as age 30. As early as age 40. Okay. And that is considered a normal age to enter menopause, and as late as age 58. Now, of course, by the age of 58, over 98 or 99% of women have actually gone through menopause. But like I said, the average age is 51. So imagine, though, if you're that 40-year-old going through menopause, you started experiencing those symptoms at 30. Just like we said, because the perimenopausal stage can be as early as 10 to 15 years before you actually go through the full change. So symptoms, we're going to go through those, but just understand how many actual women are actually going through menopause just on a daily basis. Imagine 6,000 women are actually going through menopause on a daily basis. And it affects so much more than you imagine. It's not just, I stopped getting my period. And it's not just, I got a little hot flash. And that's the part of it that, really women don't know.
That's where the education is missing. And again, many conversations that we have when we're with our clients, it's like our moms are not talking to us about what they went through, or they were a strong woman trying to just do what she had.
They were just going through, like, making sure that they can put food on the table, working, etc. And even if you did see a little something, maybe when you were a teenager and your mom was in this stage, all you saw was her maybe saying, I'm just so hot, but you don't really necessarily get the real deal, right? Or we hear them say, my aches and pains, it's the thing that I remember the most, But one of the things that was really, really important for me, especially just as a gynecologist, was when I heard this, that premenopausal women, in terms of heart disease, is 1 out of 7. But when you go through menopause, it's 1 in 3 women will die of heart disease. That is more women than will die of breast cancer, for example, of other cancers, of lung cancer. Like there's just so many other things that we think about ahead of heart disease, and not realizing that things such as high blood pressure is an indicator of heart disease, and women are getting heart disease younger and younger and younger, you know, but at the end of the day, those who are dying, 1 in 3 once you've gone through the menopause transition. So just to show you how important your hormones are.
We're living a lot longer than a lot of these lines were also established. So that's another thing to keep in mind, as we're living longer without hormones. Because
that's a great point. It's the concept that we want to live the time after menopause our most vital selves. You know what I'm saying? It's like, imagine if years ago people were dying by the time they were like 60. So if you've gone through menopause, okay, and then that's it. It's like go through menopause and die. But now, I mean, we're going to actually spend the majority of our lives, in menopause, because we're living through our 80s, through our 90s. And why not live in that phase the most vital as we possibly can, like with our faculties, meaning we're not having like Alzheimer's, dementia, and our bones are not breaking. We're not, suffering from, fractures. We're not dying of heart attacks and heart disease. Instead, we're living healthily. And we can do that if we have things like, of course, our nutrition and our lifestyle, but definitely understanding what your hormones are doing for you and how that's going to help you to increase your longevity.
We and I think it's a good a segue into again talking about just Biote, and who is our partner with hormones, and really their philosophy is amazing, because it really is 360. It's individualized dosing, and we'll talk about that more. And I know that there's all this conversation about hormones, but we're going to definitely get into the 3 key hormones that we do focus on. There's also progesterone, right? And I think we should definitely talk a little bit about progesterone as well, because there is actually a 4th one. That is very, very important. And then also again our thyroid as well. So my favorite hormone is testosterone, and I love to talk about it because so many women think that testosterone is not for women. Oh, I don't want testosterone. This is a male hormone. And I always like to say, do you know how calm they are no matter what happens? It's their testosterone. So calm. Don't you want a little bit of that? Like, yes, I absolutely do. So there's just so many other benefits, and really in individualized dosing, it's what is for you. So that is really not, that's really not. There's just so many other benefits. So I'll let Dr. Rubin take it away here.
Well, here's the thing. At the end of the day, women have actually higher amounts than men in terms of testosterone, if we're just looking at levels for levels, right? Yes, we also have a lot more estrogen, in that sense. But what is testosterone really doing for us? It's doing actually very similar things. It's helping us to protect our bones, our brains, our hearts, our sense, again, of vitality, the concept of our sense of, sexual, like libido and arousal and the experience. So testosterone is doing so much more than we actually think for us as women. And when we go through menopause, it's not just the estrogen levels that are going down, it's everything that's going down, and that includes testosterone, which could be a real reason why we start to have all of the different symptoms that we experience: low sex drive, fatigue, our energy's on the floor, our bones are hurting, we just feel like this problem in terms of focus. We can't seem to have a clear mind. We're always at a loss for our words. And so these are some of the things that are, that's going on with testosterone when it's low. Now, of course, we want testosterone. Testosterone is going to protect our brains, protect our bones, protect our heart, improve our muscle building. And, as we're going through menopause and even in perimenopause, it becomes a lot harder for us to do things like lose weight, to build muscle. You're at the gym and you're like, what the heck? I'm working out and I don't see any results. And sometimes that's just because your hormones are imbalanced. And so with that, we are suffering basically at the end of the day. Ooh, estrogen. Now, this is one of my faves. Well, I mean, of course, because it's the girl hormone, it's the woman hormone. You know what I'm saying? It makes us who we are. But at the end of the day, estrogen has 400 functions in the body, and that's for both men and women. Let's be clear. So men need estrogen too. Men need estrogen too. It's also cardioprotective for them as well. So estrogen is cardioprotective for us and it's cardioprotective for them. And so outside of that, estrogen helps with healing. It helps with our skin. It helps us to look younger. It brings collagen. It helps with our collagen and collagen building. It helps with all of our tissues. So for example, your vagina that changes so dramatically in menopause is due to the lack of estrogen. And if we have estrogen, our juices are flowing. And in so many ways, like literally, right? Our brains, it protects our brains. When women go through early menopause, they have an increased risk of things like dementia. So these are all the things that your estrogen is actually doing for you that you don't know is happening, but it is so important in helping us to remain vital, and the number one thing that estrogen is important for in terms of symptom relief is your hot flashes. So that first sign that your estrogen is not in balance or is maybe on its way down is going to be that hot flash, and it's the first thing that gets better when you are in balance. So, thyroid. All right, thyroid, a little gland that sits right here. And it is actually, it's the hormone that is the gland that secretes the hormone that helps all your other hormones to work perfectly. So it's helping with controlling metabolism. It's helping to control your energy. It's the reason why when men or women have what we call hypothyroidism, that they need to be supplemented. They have to have thyroid hormone working in their body because that's what's going to make all the other hormones work well in your body. Aside from doing all these other things, it's affecting your heart rate. It's affecting your body temperature. It affects how we gain and lose weight. It affects your mood, your cognition. It like all of these hormones are working together to make you the best version of yourself. So without one, it's like, especially this thyroid, because that, like I said, is what's working in the background to make sure everything else in your body is in lock and key step. So what does it mean to really be optimized? Like at the end of the day, we are, we'll go to the doctor and they'll say, oh, your thyroid's fine. But okay, if you imagine this bell curve that you see in front of you right now, right? Imagine, where do you want to be on the bell curve? Do you want to be all the way to the left? Ooh,
yeah, we went left.
Yeah. Do we want to be here? No, we don't want to be there, because for you as an individual, when you're on that side of the curve, okay, it's going to show up normal on the labs. But for you and your body, that could mean that you're actually low normal or low. Okay. And if we're low normal, then we're not doing everything as effectively as, our body is just not functioning at its best. We want to be at least in the middle and maybe even a little bit high normal, in order for us to feel like our best selves. And so this is where I feel like, especially just in regular traditional medicine, we have a little bit of a shortcoming because we're not taking into account how people actually feel, like the symptoms that they're experiencing. And when we draw these labs and we say, oh, it's okay, you're normal, and then you're dismissed. So you walk away from that physician feeling like, I don't understand. I still feel like crap. You're telling me everything is normal when you're really low normal, or should I even say low, period. And it's just not being addressed. And this is where we really make the difference at My Wellness Solutions, I know for a fact.
Yes, absolutely. Because I really, one of my favorite conversations to have is when that client that has been dismissed 5 times over the same
And they went to
symptoms,
5 doctors, 5 doctors.
you're told you're fine, but no one is really taking a look at, oh, you know what, your thyroid is not really super optimized, so that nothing else is going to be that's number
Working
one.
well. Exactly.
Number two is understanding what is optimized, what are optimized hormones, right? What is optimized testosterone? I'm fine at,
Exactly.
and I'm really understanding that symptoms matter. Symptoms matter. It's
Absolutely.
you have to take that.
You don't wake up. Yeah, it's the truth. You don't wake up, you were fine yesterday and not fine today, and then you're still okay. It doesn't work that way. That's number one. And number two, I get it. The hard part is when people are in what we call perimenopause, your labs really can look normal, right? It's not in that quote unquote exact menopause range. And so it's hard to make that diagnosis. And you have to be with an astute physician who's going to say, well, I know that your numbers look normal, but given all the symptoms you're having, let's like dig a little deeper, or, try a little harder to try to figure out how we can make this all fit in this one bucket of maybe it's just your hormones, as opposed to sending you to the rheumatologist, the orthopedist, the neurologist, the psychiatrist. Because when you're like suffering with either whether it's anxiety, depression, mood disorders that are happening, those mood disorders are often happening for the first time when you're like 30 or 35, really. And it could really just mean that you're starting to feel those ups and downs of your hormones.
And even just knowing makes a difference, right? You can check yourself.
Totally. Absolutely.
You can check yourself. And I'll also say this example just because we had a question really about perimenopause, vaginal dryness, and it seems to be maybe something that we don't we don't think about it when we're not in perimenopause, but we've had clients that literally the day they turn 40, vaginal dryness is here. And something that you don't understand when you've had, you've been having fun without needing any help. And now all of a sudden, just understanding, oh, wait a minute, let me look at my labs. Let me understand what's happening. It's perimenopause. Let me look at my estrogen, what's going on. It's exciting to be able to know, just knowing.
Yeah, the thing is that here's the problem with perimenopause. You're still getting a period every month, and you're still getting a period, and maybe it is starting to have like a few skips, or it's a little bit different. But because you're still experiencing a period, you're like, oh, how can I be in perimenopause, or how can I be in menopause if I'm still getting a period? How come I have vaginal dryness if I'm still getting a period? Like, doesn't that mean that I'm still young? Yes, you are young, just having all those hormone fluctuations that can lead to the symptoms of perimenopause and menopause. And they're very frustrating. I mean, I would hate to be that 40-year-old woman who is, living in her prime, right? Like she's got the best relationship, she's got the best job, she's like top on her career. And now when she comes home at night and she wants to have intimacy with her partner, she can't. She feels frustrated, and she doesn't understand what's going on with her body. And her partner's thinking that maybe she's just not that into him. Like, you can just imagine it's a part of the reason why we see so many relationships end up either breaking up or people separating, women saying, oh, I don't know what he's doing, or I don't want him to touch me, but it's not really because they don't want that. It's because what's happening in their bodies is what's signaling them to want to retreat. And when they go to their doctors, they're not getting the right answers that are going to actually help them get to the bottom of the problem, get to a solution.
And small things, as we lead into a pellet, small things can make a big impact. A little estrogen can go a long way for your mental sanity.
Mm-hmm.
So what are hormones? And there's so many hormone replacement methods. There's so many methods. There's synthetical, there's bioidentical. I'm not even going to talk about synthetic. We're not going to go there. But there are also many ways of doing bioidentical hormones. And I'll let Dr. Lubin talk here, because she obviously works with all the different types in her practice. But when it comes to pellet therapy and the work that we do, this is a little bit different. So why does delivery matter? What is that?
So here's the thing. I mean, yes, we do have bioidentical hormones that are in different forms. And first of all, if we're taking it orally, then it's going to go through all of your system. And so because of that, some of the actual potency of the hormone is lost. The availability of the hormone is actually lost. And so that's one thing if we're taking it orally. Then there's, of course, the injectable version of hormones, and especially when we're talking about like things like testosterone, for example. But that really leads to a lot of peaks and valleys and peaks and valleys. And with those peaks and valleys, you're still going to get some of the, with those fluctuations, you're still going to get, symptoms, that can lead to, for example, more anxiety, or, you just feel like you're up and then you're down and then you're up and then you're down. And so other ways are the transdermal ways, vaginal ways. And actually that's a very good option, especially for women who are suffering from vaginal dryness. That is a great way to apply estrogen locally in the area where you really need it. The only thing is that sometimes, especially for creams, it can feel messy. If we're talking about patches, well, there's a adhesive that goes with that. And so if you're someone who's allergic to adhesives, if you're someone whose just skin is really sensitive, then that becomes a problem. And so this is part of the reason why we like pellets. Pellets, once it's inserted, it's going to kind of go up at a steady state, and then you kind of stay and you can kind of coast for a while, and then it slowly declines when it's time for you to get your pellets again. Why is that nice? What makes that more agreeable is because it has that constant blood level, like all the time. When you're in that steady state time, you have that constant level of hormone in your blood. And so because of it, you just feel more even, and you're also getting a more even distribution in terms of symptom relief and in terms of how it's affecting and acting on your organs. And so, yes, of course, there's always the fact that it's of something that has to be inserted. It has to be given to you and done by a provider, a medical provider. So there are some drawbacks, but I will say that for the most part, I don't know, 9 out of 10 of our clients are like, oh my God, I need my pellets. I need my pellets.
Very few of our clients do discontinue. Just again, it's how you feel. It really does become a non-negotiable.
Exactly. It becomes a non-negotiable.
Really. And I think that conversations that we've been having just in general around longevity, we're living longer, right? So we want to protect our health. And we also want to get into really what are the protective benefits? What are the protective benefits in detail of hormone? How is it that it's doing it? Because as we're thinking about just in general, again, hormone health and longevity, you mentioned a little bit about hormones and just the bad reputation that sometimes they do get. But I'd love to talk a little bit more specifically on breast health. And we do have a question that I want you to, I'd like to start with. I had a lumpectomy and blessed to not need chemo, but they want to put me on letrozole. I'm sure you know what that is. I am 57 and newlywed and don't want to limit quality of life. And what are my alternatives? And we've been having some conversations with some of our clients on really testosterone being an option. But
So definitely when we think about breast health, so yes, like I said, again, the Women's Health Initiative really challenged how we experience and think about hormones, because it kind of gave hormones a bad rap. And the problem with that was the study design, the women that they included in the study, they already had comorbidities. They were at least 10 years after menopause. So there was so many issues with that study. But because it was such a huge study, and actually the point of the study was to see what were the benefits of hormones, because at the time everybody was getting hormones and we all knew that there were benefits to hormones. But again, we wanted to be practical and make sure that we know exactly how these hormones were working. And it went from seeing things like, for example, increased risk of stroke. We're talking about going from, let's say, 4 people experiencing stroke in a cohort, and now it's 5 who are on hormones. Now, is that a major difference, really? When we think about how many people were in the study, or and the fact that we're thinking about women who were starting the study who were already like 61, 63. You understand what I'm saying? This is not women who are, let's say, 45, 49, 51, who are early in their menopause transition. And when you think about adding hormones to a woman like that, all you're doing is helping her coast. She's just continuing the hormones that her body was already doing to protect her, to protect her breast, to protect her, to protect her. The reality is that your age is the number one risk factor for developing breast cancer. Okay. I'm not saying that younger women don't develop breast cancer. They do, unfortunately. But ultimately, age is actually your biggest indicator of developing breast cancer. And that's because you're at an age longer without your hormones. Okay. And that's actually part of what is causing you to, really have breast changes. Okay. And so in terms of, a woman who's had a lumpectomy and who maybe need to be placed on some other type of like chemo agent, so to speak, or some type of like therapy to help prevent breast cancer in the future, but don't want to lose quality of life, testosterone therapy is amazing. Testosterone, first of all, is breast protective, and it will help with vitality, especially when your oncologists are going to be, fearful of starting you back on some type of estrogen, which they may or may not do. Of course, this is a conversation that you absolutely must have with your physician. However, it's definitely been in our experience that testosterone, again, protective, and will help you to still feel like you can live life, like you're not under the table, so that you're not experiencing the joint pains and the things that are going to come with some of the therapies that you need to take when you have a diagnosis of breast cancer. So, bone health, another place where, the benefits, the protective of benefits of having your hormones. Again, osteoporosis. Imagine we're spending a gajillion dollars because of osteoporosis and osteoporotic fractures, and how that impacts a person's life. Someone who has a hip fracture has an increased risk of mortality by a lot. And so when we think about that, like about 80 million people are suffering from osteoporosis and osteoporose, and having just like problems due to bone loss and issues with their bones that we can actually prevent and improve on with hormones. So, brain health. Who wants to live till 80 and 90, not forgetting who their siblings are, their children are? Who wants to be able to get up and still go for a walk and appreciate that they are truly living? I'm sure many of us out here have grandparents or aunts and uncles who are experiencing dementia, and you're saying to yourself, what kind of a quality of life is that you have to then think to yourself, I may have to put this family member into a nursing home because I can't take care of them. They don't know where they are. They go into the street. They're disappearing. They don't know what's going on. And to imagine that if they were showing perhaps signs of dementia, or they have a family history, that those are the people who we should really be talking to about, maybe we should be, giving you that coast when we think about hormone replacement. And of course, heart health. Imagine, we already said it, we already talked about it. Premenopausal women have a 1 in 7 chance of dying of a heart attack, whereas postmenopausal women have a 1 in 3 chance of dying of a heart attack. So it's like a no-brainer. Part of the reason is their estrogen levels that decrease, their testosterone levels that decrease, both of which are cardioprotective. Other things, we're talking about cholesterol. Okay. I mean, we need estrogen for our healthy cholesterol, all right, and to decrease inflammation in our bodies, and to decrease stress in our bodies, and to decrease cortisol in our bodies. Like all of those things are happening in concert with our hormones, and these are the things in which can increase heart disease, heart attack, stroke, and high blood pressure. So.
Absolutely. So I have some questions. Dr. Lubin, can you just maybe give a brief description of the actual procedure?
Ooh, the procedure. Well, first of all, even those of you who are super scared of needles, it honestly, I hate even to say that it feels like a pinch. You'll feel like the first injection of just giving some local anesthetic like lidocaine just under the skin. But once the lidocaine kicks in, you will feel absolutely nothing. And the whole procedure takes me, I don't know, maybe 6 or 7 minutes, maybe max. And so people are always like, oh, we're done already? And I'm like, yeah. They're like, I didn't feel anything. So the beauty of it is that you are numbed. The pellet is going just underneath the skin into the fatty layer. And that's where it lives for several months. So for example, for women, on average, you're going to have your pellets working for you for about anywhere from 3 to 5 months. The average, I would say, is about 4. And for men, that's going to be anywhere from like 5 to 6 months.
Perfect. That was the next question. How long do pellets last? And also, it's very individualized. So it's important to note that if you're a super active woman, or
Yeah,
man,
you'll
then
probably be on the shorter end of that, right? So maybe having to redo your pellets, let's say every, 3 times to 4 times a year. And then for men, it's going to be 2 to 3 times a year.
awesome. It is not painful. Let's see here. Okay, I don't see other questions. Does insurance typically support this type of treatment?
So as far as there are certain, let's say, bioidentical hormones that are, you can get a prescription for, they would not be the pellets. And, but even then, you still have to find the right GYN who is really versed in how to treat women for menopause, all the different varieties of hormone replacement that is available to you. The pellet therapy is not usually covered by insurance. In our practice, it's not covered by insurance, although there are aspects that can be. So, for example, doing your consultation and the blood draw, that can be covered by your insurance, doing the labs, that is.
And I always like to say insurance typically does not work with a lot of prevention.
That's
Um,
also very true. Yeah, we're
so
unfortunately in a society where we're always just treating symptoms, but we're not getting to the prevention. And at the end of the day, hormone balancing is preventative care.
absolutely, we have a lot of different payment options, as Dr. Lubin said. Your blood draw, which is a extremely comprehensive panel, is covered by your insurance, usually fully covered. And then we have our hormone consultations that, if you stick to the end of the workshop, you'll be getting some offers to get your hormones, or just and understand what your levels are, and understand what improvements you can make. And you would be very surprised how we can really help to connect the dots for you. that have not been connected by your, again, previous five dismissals. Um, so let's recap. Really, hormone imbalances, they can start not at any age, but after 30. It's we didn't talk about this a lot, Dr. Lubin, and we don't have a lot of males on the workshop uh, that I could notice. But men go through menopause, andropause too, and
Absolutely. And actually for men, they start to lose their testosterone around, somewhere around 40, which is why they have the increased risk of things like heart attack, for example, right? But they are also experiencing symptoms 10 to 15 years earlier. So that's how come you have men who are in their 30s who are having things like erectile dysfunction, low libido, mood changes, depression, muscle, not building any muscle, starting even at ages like 30, when you think that those are the ages that guys should be like at their optimal and best, but yet they're still starting to experience the andropause that is coming.
yeah, absolutely. And important to note also, just in general, nutrition and lifestyle, and really how
Oh, for
they can
sure.
play a role in everything, in all of these symptoms, starting earlier than they need to. And when I say lifestyle, many times just being alive is difficult, right? You're stressed out just all the time, right? We've been in a pandemic where our bodies are still not really understanding what
What
happened,
we
right?
just went through. Yes, this
Just
is a
went
full
through.
fact.
So our nervous systems are crazy. So more of our hormones have been depleted over the last 4 years, and I think over the last 20 collectively, possibly. So you can definitely check your hormone levels at any time. And again, really, it's about symptoms. There's a lot of different approaches, but again, it can start as simple as just scheduling your blood draw, doing a hormone consultation. If you have joined us up until here, thank you so much. Thank you so much, Dr. Lubin. Um,
It was so
yes,
nice to be here as
so
always. I love our
absolutely.
clients. If you're not our client already, please become one of our clients, because honestly, we are a hidden gem in Harlem, and we just love our clients. So come and
Yes,
join us.
absolutely. It's those conversations that you have when you can really, again, connect the dots and acknowledge that you are not going crazy. It
You're
is your
not
hormone,
alone.
and you are
Yes.
not alone. I know
Yeah.
I'm gonna put this one because it's just so funny. Um, I
Yes, you feel betrayed by your bodies. Yes, and no one ever told you. That is a real fact. Yes, this is all true.
that is
The
a
out of
great
body
way.
experience that you're experiencing is real.
That is a great way to
Anyway,
end. So
yes.
unfortunately, they didn't talk to us about it, but now we know, right? So we are empowered and look forward to having you guys soon. Thank you so much.
Okay.